Okay, so the panel is going to focus on what to expect for privacy and cybersecurity. And I want to give my colleagues Linda Malik and Stephen Holland a chance to introduce some information around it. So I'll turn to you first.
Thanks, Jason. Hi, everyone. I'm Linda Malik. I am a partner here in the New York office, along with Jason in the healthcare and life sciences group, as well as the data privacy and cybersecurity group. And in that context, focus a lot on the issues that we're talking about, working with companies as well as academic medical centers and startups. And we do a lot of work with Stephen. We've been collaborating quite a bit in the last month or so. So I'll turn it over to Stephen.
Thanks, Linda. My name is Stephen Holland. I am a senior counsel here at Kroll in the Government Affairs Group. I came to Kroll last year after working for a little over 10 years in the House of Representatives most recently on the staff of the Committee on Energy and Commerce. And we oversee, I say they oversee health policy, but also all tech, data, telecommunications, digital communications, digital commerce. So privacy also falls within their jurisdiction as well. My background is primarily in FDA policy. That's what I worked on when I was there, including the cybersecurity requirements for medical devices, which has been mentioned tonight. But look forward to hearing your questions and chatting with y'all.
Well, speaking of privacy and cybersecurity, maybe I'll turn to you first. So I know there have been attempts over the past several years, at bipartisan attempts to overhaul privacy and security laws, in particular, create a comprehensive national data privacy security law. Where do you see the Trump administration in Congress landing on a comprehensive data privacy and cybersecurity law?
Yeah, thanks. So we saw quite a lot of activity around this last year. There was a bipartisan bicameral agreement between the Republican chair of the Energy and Commerce Committee, where I used to work, and then the Senate Commerce Committee to look at a comprehensive data policy framework, or data privacy framework, rather. Uh, that made a lot of progress and then eventually got caught up in some of the familiar politics that we've seen around data privacy and security. Uh, Questions about preemption of state law, questions about what actions would be available to private users in court. Uh, all of those kind of led to a screeching halt of progress on data privacy last summer. But I think just in the last week or two, we've seen quite a bit of activity and seen the House majority start looking again at what they can do. So the new chair of the Energy and Commerce Committee, his name is Brett Guthrie from Kentucky. He formed a working group to basically start over from scratch on what should be done about data privacy and data security. They formed a working group, and then just last week they issued an RFI for everybody, all stakeholders, to respond to very basic and high level questions with whatever level of detail they want, with, what should different players in the data world, how should they be regulated? How should we think about current regulatory regimes, whether at the state level or something like HIPAA, uh, be integrated into a comprehensive data privacy law? They're asking for that feedback. This is an invitation to everyone to start providing them with information. So I think that is a welcome sign. I think that means this will take a while again, but they're starting now. And I think that their goal is to get something done before the end of this Congress.
And I guess I'll turn it over to Aaron and Hector. If you guys had an opportunity to respond to the RFI, I guess what are your thoughts on having a comprehensive privacy cybersecurity law? Where do you think the gaps are that need to be filled for the life sciences community?
Well, I mean, I think it's the right approach. It's confusing right now. You saw on the slides 20 different states. That number has grown a lot, actually, in the last year or so, have their own privacy rules on top of HIPAA. Now, you're not allowed to undo a federal law with a state law, but you pile it on. And in some cases, and this is not my area of expertise, but they add confusion is really what happens with the consumer privacy laws versus the healthcare privacy laws. And then we've got FERPA at the educational level, which says what you can and cannot do. So it gets confusing really, really quickly. The other thing that I wanted to mention is it can't just be, I know we need to start at a national level, but this is a global problem. Life sciences, healthcare data is global. So if we try to not regulate data in the US, it doesn't matter. You actually have to perform at a global level. So there's still GDPR, there are still the new privacy laws in Australia, New Zealand, and the ones that are developing in the Middle East and Asia. And GDPR is confusing. I mean, I thought GDPR was a great start, but every country still has their own Data Protection Act in place also. So you really do have to understand the set of controls at a larger level, how they all intersect and work together. But I want to repeat that one thing about your data, and if we're regulating it or not in the US, that shouldn't be your target. It should be global, because you're going to have to know where your data comes from, where it goes, who's using it, and why they're using it. And I'll tell you who does this really well: cyber attackers. Attackers use data, they use automation, they use AI, they share information, they monetize this, and they are extremely profitable because of the way that they do this. I mean, you'd never think about that the cyber attack process is really a very collaborative process by those, what we call nefarious actors or bad actors. But maybe we need to learn something from that process.
And I think I would add into that just going back to security. I think I turned it off. Oops. Great. Thank you. I think I would add into that, going back to security first principles and forgetting what the regulatory bodies are actually out there telling you what to do. Go do what is the best for your organization, for those attack vectors that Hector was talking about.
And I just wanted to add a couple things to this too. So to Hector's point, which I think is a really good one, that this is a global issue as opposed to, sort of dealing with different sectors. One thing though to note from a compliance perspective is when GDPR came out and when we started to see enforcement actions around GDPR, in my work, I saw a lot of clients saying, well, we're compliant with GDPR, so we're good, right? We don't need to, that's a stringent standard. Isn't that stringent enough? And the problem with that approach is that the EU approaches data privacy and cybersecurity very differently than the United States does. The United States will follow the states as opposed to federal laws. The states are now more like EU laws in terms of following the individual. The federal laws that we have, or federal regulations, I should say, that we have, HIPAA being a prime example, follow the entities, the covered entities, as opposed to the individuals whose data is at issue and at risk. So it creates a lot of complexity in terms of, how to comply and make sure that you're compliant. The other thing to note, which I think will be really interesting coming out of the request for information, the RFI that Stephen mentioned, is that right now, we're at a very different point in terms of the posture and attitude towards privacy protections and cybersecurity protections than we were even a few months ago. And with the federal legislation that had been proposed, states like California, for example, came forward and said, what about our state laws? And I do think that we're still going to see a lot of pushback from the states that have worked so hard to implement their own protections. And it'll be interesting to see whether the federal government is going to say, we're passing something that's going to preempt all of that, and how that plays out. But I just want to point out that the complexities that Hector's talking about are real complexities in terms of how you make sure that you're following protections for data that is moving around the world.
And I guess speaking of protections, we do have some laws in place that are trying to fill these gaps. So, for example, the Chips and Science Act, right, which President Biden had put out guidance around how research institutions could actually comply with that. Again, Steve, I'm going to turn to you because we were talking about sort of what has to be complied with. What have you heard about where the Trump administration is going to land on the Chips and Science Act implementation?
So those guidelines that were drafted by the Biden administration and released last year are interesting because they're guidelines for agencies for complying not only with Chips and Science Act but also with the National Security Presidential Memorandum 33, which was originally instituted by the Trump administration. So if he is to roll back those guidelines, it would also likely be in issuing a new NSPM, which I don't expect at this point. I mean, I think there's been a lot of unpredictable stuff the last month, but I don't expect that to change at this point. And then as far as Chips and Science itself, the statute is quite clear about what's necessary here, and I don't think Congress is going to open up that can of worms at this point either. So I think that we can, at least for now, rely on those guidelines that came out last year.
Now, speaking of guidelines, one of the things that has happened is that a lot of guidelines and guidance documents have just disappeared from various different agency websites. So one, for example, is the diversity in clinical research guidance that came out from the FDA last year. And I guess I'll kind of open this up to the panel. I'm curious how companies should be thinking about functioning or operating in a sort of this environment. And what kinds of strategic choices they should be thinking about, given sort of the uncertainty and the guidance and enforcement activity that may come out of the Trump administration around some of these guidance that have been removed around cybersecurity and data privacy in particular.
Good. Well, one of the things I'll say is the industry is taking control of some of these requirements. If you look at the IEEE UL just published their final guidance, it's called 2933 for medical device cybersecurity. It's quite comprehensive level of work, all about medical device cybersecurity, about the use of software bill of materials. They mention AI. It's almost 300 pages. I haven't read the whole thing, but I still haven't found an area where they've lacked some guidance. What's going to have to happen is we as an industry are going to have to do that work. I don't think we can rely on the government, is really what I'm saying. The other thing I want to congratulate Stephen for leaving before he got fired by Elon too. I just have to throw that in. But I could listen to him all night, because having that insight into what goes on at the government level, at the federal level, is so critical, and we don't get enough of that either. So that's why I do, in my conversations with the people who developed the new 2933 standard, with our customers, with our partners, is as an industry, we're going to have to do that work. And we're going to have to be part of rewriting it. So responding to the RFI is something that I do encourage in order to just be part of the solution and not part of the problem, really.
I'll add on to that. I think it's interesting, talking about new standards that are coming out through industry. That's not unusual. I think one of the things that's really helpful a lot of the times is when FDA can lean in and work with industry and start to adopt those standards in how they're evaluating it. That's one of the things that I think I will be looking for out of this new administration, which has, at least on the surface level, announced some sort of hostility to working with industry. If you look at the secretary, he's certainly had some concerns with industry being involved with regulators. I think that there was often times especially with the Center for Devices and Radiological Health at FDA, a lot of good collaboration between industry and the agency itself. I think one of the things we'll be looking for once we have a new FDA commissioner and we have some more stability there, hopefully soon, is whether that kind of collaboration will continue to happen. Because once it's developed by industry, FDA often wants to support that and work with it and start building that in to make sure that everybody is following at least those industry standards. They might try to work constructively to change those standards or improve them or augment them, but oftentimes I think that collaboration hopefully will continue. But again, that's an area where I think industry is going to have to engage with FDA and with Congress and other policymakers to make sure that kind of collaboration can still happen.
I think I'd just like to add that a lot of these, a lot of the security model and data protection doesn't necessarily need to exist out of the government telling us what to do. A lot of these frameworks have existed forever. You look at something like IDLE, like the IDLE framework there, going back to just what it means to protect a desktop. There's just maybe not such a need for us to always have it pushed down from the top. A lot of these frameworks exist. It's possible to go out there, find legacy frameworks, existing frameworks that are strong enough to help us get to a good standpoint. We don't necessarily need new rules coming down.
I just want to add one thing, and I think that's an excellent point. Stephen and I were just talking earlier today about the fact that there was a temporary restraining order mandating that these guidances that had been pulled be restored back to the websites. That temporary restraining order expired today, and the judge involved let it expire, which means that the agencies can continue to pull guidances from websites pending, further argument about the issue. I think what's important there is that, to the points that have been raised earlier, it will become even more important, I think, for industry to both engage with the government, because there is necessarily, at least for a time, going to be less reliance on these guidances because that's in a state of flux. And also from the standpoint of best practices within the industry, particularly as it relates to cybersecurity, there are a lot of good reasons to look to the industry to create best practice standards, because if you do have an incident, as we all see and as many have experienced, that can be catastrophic for the business from the standpoint of class action lawsuits, from the standpoint of holding up business, from the standpoint of losing trust with your customers. So I do think that in this environment where things really are in a state of flux and will be for a while, those 2 points in terms of industry collaboration with government and industry really leaning into best practices will be important.
And compliance, like a lot of things, costs money. And so we have two sort of sources of funding that you can look to that may be impacted by this new regime. The first is investors, but also NIH funding. And so we know that there have been NIH grants frozen, but we also know that there is now the Trump administration wants to hold indirect cost rates at 15%. And so I guess turning to the NIH side of this first, I think, Stephen, I'll turn to you again and maybe give your thoughts as to where those issues stand.
Sure. So a couple of weeks ago on a Friday night, the NIH announced that they were going to cap indirect costs at 15%. Indirect costs, for those of you who aren't working in this space, are those facilities administration costs, the overhead that gets paid on top of the direct grant costs that NIH awards. So if you are awarded a $10 million grant, you will get some percentage of that on top of that to help, keep the lights on in your lab, make sure that you have grant administrators, compliance folks, ensuring that you're following all of the requirements. Those costs get paid through those indirect costs. Some institutions have negotiated rates under the current regulatory scheme of 50+% administrative costs, And those are necessary in many cases in order to make sure that these grants can actually be used by these research institutions. If a research institution gets a $10 million grant but doesn't have the funds to ensure compliance or manage the grant, keep the lights on, then they can't essentially afford to accept that money. So coming in and capping everything at 15% is a dramatic cut for a lot of these major research institutions that have been working with NIH. And what we are afraid of is that this could lead to a dramatic reduction in overall research at these institutions. There is currently a TRO in place blocking this change from going forward. That was just extended. This is something that I think is one of the first things in these first few weeks of the Trump administration, where there have been pauses and people being laid off, et cetera. This is one of the first things that I saw really get the attention of both sides. They're both the Republicans and the Democrats in Congress. Congress had already put forward in law that NIH was not allowed to do this. They put this in the appropriations law every year since 2017, that this was not allowed to happen. And yet the administration is moving forward as if that is not in law currently. So when Congress acts repeatedly in a bipartisan way to make sure that this doesn't happen, then they often have already stuck their neck out to get there. That makes it a little easier for them to go out and push back against the administration again. I think they will continue to push back. This is something where, again, there's a lot of interest across the country at research institutions where they could see a dramatic cut. And but what it's going to take is these research institutions and others in the life science who are affected by this to let the members of Congress know what this means. Because if they don't hear that, then on March 14th, this provision in law that says NIH can't do this, that goes away when the federal government's funding expires. If that provision isn't renewed along with the federal funding, then all of a sudden we're in a completely different world for NIH and these indirect costs. So I think the engagement level and the pressure just has to stay on.
Yeah, good times. So I think that the other impact of this on the investment side, right? A lot of pharma, biotech really used the academic medical centers in the last decade or so is sort of their benchtop research, right? So on the acquisition and investment side, with a lot of pharma, creating their own venture arms. And so I'm curious, Linda, I'll ask you, it seems as if there's a lot of sort of holding patterns in the investment side of things, but also there has been impacts to companies, right? I mean, without funding, a lot of companies, I have to assume, are folding shop or looking for other opportunities. So I'm just curious what you've seen in the marketplace around those investor and business areas.
Yeah, so there are a few layers to this, but I'll just use an anecdote from today. One of my longtime contacts in my network, who runs some accelerator programs in Connecticut and in New York, emailed me to tell me that a number of, and these are competitive programs to get into, so these are sort of cream of the crop startups that are in the accelerators that she is part of. That they have lost SBIR funding, so small business funding going to startups in the life sciences, because that funding has been frozen. And because it's been frozen, they are operating on such thin margins that a number of them have already started dissolution of the companies. And then at the university level, to Jason's earlier point about benchtop researchers and so on, because of both the suspension of funds as well as some of the fear around what is going to happen, there have already been layoffs of personnel in the research space. So what is the impact that this is going to have on investment? I think that to the extent that, investors are depending on a pipeline of life science companies for them to be able to take a look at, that pipeline is narrowing. And I think that's an issue that has to be considered. And then secondly, from a funding perspective, to the extent that there is now more dependence on private sector funding, that is another issue for, investors, VC firms, and so on to think about with respect to, can they bridge that gap? Are they willing to bridge that gap?
So I know we're just a little past 6:30. I know we're a bit flexible, but I want to make sure that if anyone from the audience has any questions, then we have an opportunity to hear from folks and answer any questions you guys may have. Particularly with Stephen here with his insight and knowledge.
I do want to comment on something Linda said. So we're looking at this and we're seeing the challenges. One of the things that I'd always say is look at the opportunities. If you're an early stage company or even next series or so on, there are accelerator programs available from organizations like AWS and others. Also, one of the things about cloud computing early on, I started working on this when Microsoft launched their cloud services. A lot of what we saw was a really large reduction in the cost of just buying hardware and buying those types of things. So there are some things that you can do. It's not going to be perfect. I know it sounds a bit doomy and gloomy because it probably is for the next few years, but there are opportunities out there. And then the other comment I have around HIPAA. I do think it's time for a rewrite. The original HIPAA law, the final rule, was published in August of 1996. We had no cloud computing. The World Wide Web was launched at the end of 96. We had the concept of AI and ML were in place, but they weren't used the way they're used today. There was no Gen AI. And we had to bring all these things together. And it is going to be tough. I'm not saying this is going to be easy, but there are things that can be done to continue moving forward and just get through this.
Well said, Actor. So any questions?
So the overall question, just to summarize it, is if everything's running on my phone and I'm running an encrypted chipset, which is protecting my identity, protecting my data, aren't I protected? What I'll say is that's a great way to look at it and believe that that's truly happening. But once your data leaves your phone, one of the biggest challenges we have in healthcare are copies of data. So a lot of organizations have started to write into their contracts that they don't want you to copy their data. It's one of the contractual agreements that AWS makes with customers. We will not copy your data from one region to another unless you do it. And that's just the start of how we keep your data protected and private. So be careful with believing that the device you're using, and it's any device, because today medical devices are very vulnerable. There are a lot of changes coming, but they're also responsible for about 34% of all incidents. Once your data leaves your device, even if it's encrypted, there are things that still can happen with it. And the other thing, I do think putting encryption at the chip layer, which is what's been happening, and we're going to see more and more of that, is that extra layer of security. Nothing is 100%. Please don't walk out of here believing you'll ever be 100%, because you won't. So there is that probability of something happening.
You need to have the qubits. Even in AWS, if you see the entire infrastructure in AWS, you need to have a security which is secured by quantum. Because once you have the quantum, even if you put quantum, your cybersecurity and cryptography is within seconds, you can encrypt all the codes. So if you don't have a solid security at the base, which is supported by qubits, it's going to be challenged every day. And that's what we are progressing right now with Microsoft and Google coming out with the quantum labs, right?
Yeah, it's going to be...
Quantum as a whole, you can crack any code in the cryptographic.
I just don't know how many of us are going to have cryogenically cooled computers to take care of quantum.
Yeah, it's going to be interesting when we get there. But my overall comment is proceed with caution.
Yeah.
Great question. Anything else, Gary?
I was just going to ask. So, with a lot of the companies that we work with are relatively early stage, kind of coming out of an accelerator and an incubator. So we talk a lot about, data security at an early stage, just kind of building some of the fundamentals like Aaron talked about, using like a NIST framework or something like that. when do you recommend really starting to think about compliance and regulations? At what stage does that light need to go off and we need to start thinking about expenditures and really,
Right. So the question was for early stage companies in the biotech life sciences area, at what point do you start thinking about legal and regulatory compliance? That should be part of built into your company from the very beginning, right? Because as I mentioned when I was discussing, right, if you don't structure your compliance program to intake the data appropriately, then you probably have data that you can't use or creates liability for you. So what we talk about a lot is really the strategic thought process of, and it also goes to scalability, right? Which is, where is your company going to go? Where are you now? Where do you want to go? And so putting those compliance systems in place and policies and procedures at the very beginning is important, because if the foundation is solid and strong, then the company is going to build up from that. So I would say that they go hand in hand, right? And again, when you're having conversations with folks like you and AWS, they need to understand what architecture exactly you're looking to implement, right? Because there are definitely lots of different controls that you can put in place. And again, everything is in different regimes that you may have to comply with. So yeah, so the compliance program should go hand in hand with all this stuff.
Yeah, I would just, the only thing I would add to that, and I would underscore what Jason said, is, we do a lot of coaching of early stage companies, and the thing that they think of first is, okay, I've got to get the right corporate structure, and the second is, I've got to protect my intellectual property, and then they think, okay, I'm done with legal for a while, and to Jason's point, it's really important at the design stage to think about data privacy and data security, because that's your asset. And if you have not safeguarded that asset, and if you have not gotten the consents that are appropriate and necessary in order to, say, monetize that data later on, you have to undo everything. And it really, becomes a fundamental problem of the company. So very early.
Any other great questions? Well, we'll certainly be around. You can feel free to come say hello to us when you get a drink. There's some more food over there. So I just want to say thanks again to everyone for coming tonight. Hopefully you got something good out of it. And thanks to Gary and PTP and Hector for meeting with us, and Han as well for participating. It's great to have all these various insights from the folks that are in the industry. So yeah, so thank you all.